Our next guest speaker is a doctor in clinical neuropsychology, a senior research fellow who has been involved in multiple studies on improving diagnosis, disease progression, delaying decline in dementia. He's an award holder in health aging catalyst, a clinical neuropsychologist, a clinical scientist who is currently working at the Dementia Research Center, who's done a lot of work around dementia. Please allow me to welcome Dr. Aida Suárez González.
Good morning, everyone. And first of all, thank you very much to the organizers for giving me the opportunity to share this space with you today. During the following minutes, I will be talking about the impact of COVID-19 in care homes from an international perspective, and I will be focusing on people with dementia, both because I'm a dementia researcher, but also because the majority of people living in care homes have dementia. And I've split my talk into sections. So in the first section, we'll be discussing what happened during the first months of 2020 in care homes across the world. And in the second section, we'll be focusing and discussing the impact that isolation measures had on people with dementia living in care homes, but also living in their private homes. So let's travel back to 2020, March 2020. COVID was spreading very fast across the world, and actually many countries were entering total or partial lockdowns. And just 1 month after the pandemic hit Europe, colleagues from the London School of Economics published emerging data suggesting that half of all coronavirus deaths in Europe were happening in care homes. And I'm pretty sure that many of you remember this article published by The Guardian featuring this very important piece of research. And indeed, as the pandemic progressed, we learned that care homes across the world were facing huge challenges dealing with COVID-19. One of them, perhaps the most important, was dealing with COVID outbreaks and controlling COVID outbreaks. And what you are seeing in this slide here is a report of Doctors Without Borders who had to intervene in 5 countries in Europe, supporting the care home system. And this happened even in small countries historically very well known for their excellent social care systems. And these challenges of dealing with COVID outbreaks in care homes not only happened in Europe, but other high-income countries across the world had to resort to exceptional measures to support the response of the care home system to the COVID pandemic. And another very common challenge that care home systems faced across the world was having to deal with ethical issues resulting from not being able to keep delivering and providing a standard of care that was aligned with their values and their moral. And we all remember news and reports about people in care homes being denied access to hospital, do not resuscitate orders being imposed, and raising concerns about the increased use of physical and chemical restraints. And this again was reported in many countries. So, prompted by all this news and emerging evidence, Jill Livingstone and I and colleagues from the London School of Economics and many other institutions across the world decided to join forces and work together to document the impact that the pandemic was having on people with dementia. And this collaborative effort produced this report that was published on August 2020. And in this report, we summarize data from 9 countries and 6 continents. One of our perhaps more important findings in this report was that people with dementia accounted for between 30 and 75% of all deaths in care homes. And we also report that by August 2020, 25% of all national deaths in England and Wales were people with dementia. 31% of all national deaths in Scotland were people with dementia, and 19% in Italy. But quite a disturbing fact that we also found was that actually for 7 out of the 9 countries that we investigated, we didn't find national level data. So these countries were not able to offer public figures, at least that we could locate and report about how many people with dementia had died because of COVID. And not only that, but we also found that the majority of countries didn't even know or were not able to provide data about how many people with dementia they had living in care homes. So I'm very sorry that Claire is no longer here to actually see the importance, international importance of the study that she is doing, trying to create a minimum data set. And another important finding was that we were able to identify quite a significant number of anecdotes suggesting that the human rights of people with dementia have not always been observed during the pandemic. And I'm not going to say that, I'm not really trying to convey the impression that this was the norm, but it was more than anecdote. So in many different countries, this was reported in the news, and there was really abundant anecdotes pointing in this direction. And in particular, what we saw is that people with dementia living in care homes were not given priority to access intensive care or hospital admission or even general care. And what you are seeing here are quotes from our report making direct allusion to these facts. And something that I would really like to emphasize here is that care home providers and care home staff played a critical role flagging up these issues and reporting them to both humanitarian organizations and to the media. And actually there is a report of Amnesty International UK acknowledging the important role of care home workers on flagging up these problems and helping to document them and make them visible. So that was the situation in 2020. This is what it was happening in the world in 2020. And of course, this led to isolation measures to prevent and try to control the spread of COVID-19. What was the impact of these measures? These policies that were put in place to, in principle, try to protect very vulnerable people. So again, Jill Livingstone and I and colleagues from India wanted to investigate this issue. So in February 2021, we conducted this rapid systematic review, and we collate all the available evidence up until that date. So we scrutinized 3 databases, and we identified 15 suitable papers. And what we found was first that only 2 of those 15 papers were based on data collected on care homes. And what these 2 studies found was that increased symptoms of depression and anxiety were seen since the start of the pandemic on residents with dementia. And this other study showed that there was a worsening in memory, mood, and ability to perform activities of daily living in around half their residents. And actually, these findings were in line with the rest of the studies. So the other 13 studies that were based on data collected in people living in the community in their private homes also showed that also people with dementia living in their homes were experiencing a worsening in neuropsychiatric symptoms, in cognitive decline, and functional decline. And we also found in our review a few studies looking at the use of pharmacological therapy and reporting an increase in the use of antipsychotics and benzodiazepines. And for the 2 studies reporting data on care homes, this information was just not available. But the 15 studies or 13 of them at least included in our review was pretty much reflecting the perceptions of either people with dementia living in the community or their relatives, since the majority of the studies in that review are based on data from research conducted in the community. But how about care home workers who were looking after people with dementia in care homes? How were they experiencing these events? So this this Canadian team, asked themselves the same question, and what they did was to administer a cross-sectional survey among care home workers in the province of Ontario. And they obtained 227 responses, and what they saw is that around 50% of respondents, these were care home workers supporting people with dementia in care homes, and 50% of them said that quality of care have suffered due to the introduction of isolation measures, and that more than 60% of them said that people with dementia were experiencing a worsening in cognition, mobility, and behaviors that challenge. And now, how the experience of you being working in a care home and witnessing this impact on the residents, how does impact you as a care worker? And this same team asked this question as well in this survey to these same workers in the province of Ontario, and this is what they found. So all the list that you are seeing in front of you is a list of factors that contribute to moral distress in care home workers that were participated in this survey and who were looking after people with dementia. And what you are seeing here is that the majority of them, from bottom to top, I'm going to start in the bottom, the majority of them said that seeing people with dementia being deprived from meaningful activities and the opportunity to stay in contact with their families receiving visits had a massive impact in their moral. It was very stressful for them, for the care home workers, to be witnessing the situation and being exposed to this situation. And the next thing that they found very stressful was having to apply policies that, in their opinion, conflicted with the best interest of the resident. And the third thing that they found very stressful was having not enough staff or a high staff turnover. So they were experiencing high levels of moral distress. Then how did this impact on their own health? This was a question that this team also asked through the survey, and these were the responses. So a large proportion of these workers said that having been exposed to these levels of moral distress made them feel physically exhausted more than one time a week. And also trigger very often, more than once a week, feelings of anxiety, frustration, anger, feeling powerless, and gave them difficulties to sleep. So when we look at all this data, one cannot help but think all these measures that were into place to, in principle, support very vulnerable people, they seem to have caused so much damage, both to people with dementia and the people who were looking after them and protecting them. Were they the right measures? So this team from college, King's College here in London, also asked themselves the same question, and they decided to investigate and to assess these policies, and they conducted this international review. They scrutinized 7 databases and ended up selecting 103 papers between empirical studies, review, and policy documents. And what this team concluded was that there is insufficient empirical evidence to support these policies, and more and better research is needed when it comes to the implementation of these policies in care homes. And another thing that they found was they identified these 3 elements, these 3 barriers or facilitators for the correct implementation of COVID-19 policy measures in care homes. The first one has to do with having enough staff. The second one has to do with receiving clear guidance and communication from local governments. And the third one has to do with first having the physical space to comply with policies, because many care homes were physically unable to follow some of the guidance, and also the use of innovative technology. Well, when they talk about innovative technology, they actually talk about Zoom, and using Zoom to connect families and residents. And the fact is that many care homes, although they tried to implement these measures, they didn't have enough technological devices and resources to supply all the residents. And also some of the families were still not well versed in the use of these technologies at the beginning of the pandemic. So all in all, this is the summary of my talk. So we've learned that the COVID-19 has produced very high rates of deaths among people living with dementia, and that, well, that they were no longer living with dementia, because it was really this very serious situation and of great magnitude in many countries. Governments struggle to support and provide appropriate support to their care home systems. This is something that happened in many different countries around the world. Quality of life and the human rights of people with dementia suffered as a consequence. Isolation measures had a negative impact on people with dementia, but also on the health of care home workers who were looking after these people with dementia. And apparently better evidence and data is needed to inform policies. But all this seems quite a long list of negative facts, and I don't want to finish like that. So I'm going to finish with a positive, because COVID has also brought a positive legacy. And the first one is that never before we've talked so much about the human rights of people with dementia. It has attracted a lot of attention, and I think we are gaining momentum. The second thing is that it has heightened global awareness of dementia and the long-term care system, and it has put the spot on the importance of social care research. Again, we are talking a lot about how important this research is to improve the provision, and also to apply policies that are based on good evidence, and how important it is for a country and for the well-being of the country that we have strong social care systems. Thank you very much. And I think that we open the floor for questions now.
Aida, and thank you for the presentation and the work. And these, well, you said that you did these papers with me. I did a little and you did nearly everything. What there's going to be something is going to happen in the future, another pandemic, another infectious disease. What do you think we can learn from all of this work, particularly in care homes, which, as you pointed out, are really the places which suffered most, which had clusters of vulnerable people in them, and where there was the most suffering and the most death?
Yes, that's a very interesting question. I think that we need to use this time that we have now to do research, to learn more, because something that surfaced and that was very exposed when the pandemic started was that we were underprepared to face a situation like that, and also that the care home system was so unsupported that it was very difficult for them to react or to comply with the measures that were being in place and indicated by governments. But I think that now we have this space in which we've realized this research is very important, and we should focus on doing more of that research. So, for instance, if a future pandemic comes and we need to isolate people living in care homes, how can we do it in a way that doesn't produce any negative effects? That's a massive challenge. We don't have responses yet, but I think that we should invest research efforts in learning how to implement all these measures in a way that it is compassionate and it doesn't damage people with dementia. Because now we know how negative the effects are, but we don't know how to do it better neither. So I think that will be very important.
I mean, one of the things, I think there'll still be lots of negative effects, but is to not discharge people whose status, infection status, we do not know, to care homes to be with other people. And that we actually know, and it would be fantastic if there was legislation to prevent that happening. I thought it was totally shocking. And the results were absolutely appalling. I don't have an answer to isolation, but at least a beginning of an answer about putting people who are focused for infection among the most vulnerable of the population. And the fact that that was policy, no, it wasn't a mistake, it was policy, is appalling. And that's something that, you know, that's one beginning of an answer, although it's not in any way the whole story.
Thank you very much. I have a question from Marion. She says, thank you for an extremely interesting presentation. You say the impact of COVID-19 has implications for the human rights of people living with dementia. What sort of rights do you have in mind? Should they be giving new legal rights?
Oh, they have the rights. So they are human rights. So they were just denied those rights. So for instance, I remember as you were asking me this question, a very controversial guidance that was produced in Spain. So some societies, perhaps not very sensitive with the needs of people with dementia, in particular I'm talking about the Emergency Medicine Society, produced this guidance, which is published, the paper is published, everybody can read it in the internet, saying that people with dementia, without specifying the level of severity, should not be screened for intensive care, should be ruled out straight away. I think this is an entire violation of human rights, and it doesn't comply with any legislation, doesn't really make much sense. But this has been happening, and there is proof that this has been happening, and those are human rights. It's not that people with dementia come from a different planet and they need a new legislation for them. It's all of us when we develop dementia, and human rights should apply no matter what your condition is.
Hi, I'm Porrick Garrett from the Jewish Deaf Association. So I'm really welcome to see all this research that has been done, because I think the feeling was that people were left alone, care homes were on their own. So it's great to see that the research has been done and will inform things for the future. One of the things that we come across a lot is the impact of wearing face masks. And I suppose, what kind of discussion has there been, or what kind of debate has there been about the negative consequences of wearing face masks in terms of communication? And just on a human perspective, you know, not to be able to see the face of the staff who are caring from you, the actual impact of that on the person. From a hearing loss perspective, trying to lip read was impossible. And that's still a factor in a lot of homes where face masks are still being used. But how do you weigh up the value of that against infection control? The other thing is really helpful to see the statistics around what staff themselves were saying and the impact on them. And I'm just wondering, so far into COVID has still not gone away, it's still impacting on homes. How can we respond, you know, to support staff? I mean, I'm amazed at people's resilience, but I also see the burnout factor as well. So how do we respond? And, you know, some homes have a lot more resources than others. Some homes are very small homes, they don't have much funding, so they do need, staff do need support from outside. So I was wondering about that.
Thank you. Very difficult questions, in particular the second one. First, about the masks. So there is research conducted on the use of masks, and of course they are a barrier for communication for everybody. And for people with dementia who may already have difficulties communication, so it is a bigger barrier. So it does affect communication. But the thing is that masks have also proved being a very effective way of protecting people from getting infected. So it does seem that makes a lot of sense, wearing masks. What I sometimes wonder is why 3 years after the start of the pandemic, we don't have better masks. There hasn't been innovation, because I was expecting during the first months of the pandemic that by 1 year later, we all will be wearing these transparent masks or things like that, and that didn't happen. So I think that, these are the type of research and innovation that we probably need, focusing on the well-being of people, on quality of life and quality of care. Your second question about how to better support care homes, I think that it is a question of resources for a start. And perhaps there are many other things that can be done, but it is a question of resources. And actually, one of the variables that comes up all the time is shortage of staff and resources. So there is very little that you can do to support a care home that just simply doesn't have enough workers in it. So I think that the first thing is sorting that out. And I think all that has to do with countries and governments realizing that education, healthcare, and social care is the priorities, what make our societies advanced societies, and that should be put very high up in the agenda and should be the priority.
Hello there. My name's Paul. I'm an agency nurse in care homes. Thank you for your presentation in presenting what we as nurses and carers went through during the pandemic, while the rest of the country were paid to sit at home and watch Netflix. We were putting our lives at risk. Thank you. So I look forward to hearing how your reports affect inquiries and taken by government. And my question is, of course, when care home residents were all given do not resuscitate orders, it was obviously people with and without dementia, and also there was not the testing for COVID like it was in hospitals and not in care homes. So there's another discrepancy. So, sorry, I forgot what my question is now, but anyway. So it's like it highlighted so much inequality. And I don't know how well was the government in leading on that? I mean, it's all right after the event, thanks for your reports, but it was just, just total failure. And when we're there experiencing it. Thank you.
Thank you very much. Yes, something that I would like to say is that when we were collecting data and speaking with people and professionals from all these countries, the 9 countries that we investigated, and we struggled so much to get data from social care systems, we didn't have the same problem with hospital data. So countries know how to do this well, and the majority of countries were well organized when it came to give statistics, for instance, about how many people who died in hospitals had dementia. So there is the capacity and there is the infrastructure to support the healthcare systems. It's just that is not happening for social care, and there is this inequality and this discrimination towards social care, but the infrastructure, the potential, the possibilities exist. They are already being applied in healthcare. So there is more work to be done to actually reduce this gap between how much importance is given to healthcare and how much importance is given to social care. You are very right about the inequalities, massive inequalities, yes.
Thank you. There's another question from online from Zayanai. She asked, there was a widespread use of technologies such as Skype, Zoom, and other things to connect people. However, this was sometimes not appropriate for some people with advanced dementia or other complex needs, causing them and their loved ones more distress. What is your view on the future for people with these needs when it comes to these resources? Thank you.
I agree. I think that the use of technology is good for some people, but not for others. So during the pandemic, my granny, who lives with dementia, and was isolating, of course, and living with another family member, I will call her every day by Zoom. And she will always get confused because she didn't know if I was there with her and she wanted to give me a cup of coffee, and then I will not be able to take the cup of coffee, and then she will get all confused about how many people there were in the room. And this can be very disturbing for people with dementia who cannot understand what that means, that screen. So I don't think that works for everybody. I think that is a resource that we have, but it should be offered as part of a wider toolkit of resources. And perhaps in situations like this, a personalized assessment should be conducted, and these residents who can actually use technology, let them use technology, but these others who have these pressing needs and they need to see their families, let's investigate what's the best way and safest way for them to stay in touch. That's what it connects with what I said before, responding to Jill's question. We are now in a time where things are calmer and we have the time to investigate how to do this well, because during the pandemic it was impossible. How could you ask any care home to participate in any research study? Are you crazy? We are dealing with all this terror now. We don't have any time to collect any data, but now that we have more time, let's now investigate and take lessons from what happened and learn new ways to. No, so something that I've learned from preventative experts in the prevention of infection control is that you should not try to isolate the person, you should isolate the virus. And this is something that I think we need to take forward, and we need to think of better ways to protect people with dementia, with communication difficulties, with cognitive difficulties in the face of these events. And now we have the opportunity to do it. So it is the time.